Limits of risk adjustment coders. Apart from the possibility, according to ICD-10-CM Guideline 1 of 15, to link certain diagnoses themselves, the medical coders do not have any power of diagnosis coding decision. They must apply a strictly literal interpretation to the healthcare provider's medical record documentation. Industry standard diagnosis coding guidelines require medical coders to interpret the healthcare provider's medical record documentation strictly. Coders are not allowed to connect the dots, make assumptions or presume to know the healthcare provider's intent. Risk adjustment coders cannot apply a clinical interpretation to information within the medical record, such as diagnostic test results or physical exam findings. Accurate diagnosis code assignment is dependent on the healthcare provider clearly describing each medical diagnosis to the highest level of specificity. Coders are not clinicians and may not infer a diagnosis based on prescribed medication when it has not been documented for coding purposes. A medication list can be a source of meat, but it may also provide an inventory of diagnoses for a coder to look for support of a diagnosis. And coder should tread lightly regarding diagnoses listed on medication lists that are not addressed during the current visit. The provider must document all relevant conditions and report that medications have been reconciled and updated during each visit. The coder should never make assumptions regarding the language used by physicians in their documentation. Accuracy requires that the documented language record be abstracted exactly. For example, if the healthcare provider notes a tumor, the coder should code for tumor, not cancer. And if the healthcare provider documents hyperparathyroidism, the coder should not submit the secondary renal hyperparathyroidism code in the claims. Coders are forbidden to infer a diagnosis from a diagnostic test result. The physician must state the diagnosis even when it seems obvious. If the physician documents laboratory values into the records but does not report a diagnosis, the coder may not code or assign a diagnosis code for this laboratory value. If the coder believes a diagnosis was inadvertently omitted from the documentation, he can query the physician.